Hey, it's Dr. John with the Healthy MD and back to talk about insulin again. So this is the second part video series to talk about insulin. If you missed the first one, it's down the link. It just talks about kind of more of the history of insulin, how it was discovered, a little bit more about the how it works a little bit in the body, but really I want to dive in today, talk more about insulin's effect in the body, because I think it's really important if we're going to talk about insulin resistance and hyperinsulinemia, understanding and taking a step back on what insulin in a normal state is supposed to do, and then break out and look at, okay, what's going on with insulin resistance? What's the difference? And what can we do to get back to a normal insulin sensitivity? Now, I'm here to say that insulin's getting a bad rap. It's not the boogeyman. It's not the villain, the nefarious villain that's been made out to be. Insulin is vitally important for life. If you look at type 1 diabetics that don't make insulin at all, if they don't get insulin replacement and injectable insulin, they'll die from that. So we need insulin to live. The problem right now is we're seeing huge amounts of insulin resistance, more related to diet and other type of environmental issues. So again, we need insulin. So it's not the boogeyman, but again, we need to figure out a better way to use that insulin response to our benefit and not make it pathologic, not make it lead into chronic diseases that we're seeing. The primary role of insulin is really energy storage, but it also has an anabolic or building component to it, and probably also as important is an anti-catabolic. And what I mean by that, it also prevents protein and tissue breakdown in the body as well too. So we'll kind of dive in and talk a little bit about each of those. But I think really what you want to talk about today is what happens. How does insulin actually work in the body? So when we eat, stomach, small intestine breaks down that food pretty much into kind of three components, the three macro ingredients we talk about. So the protein, fat, and carbohydrates. And carbohydrates get broken down pretty much into glucose, sometimes fructose, and other simple carbohydrates. As our blood glucose levels go up, that actually triggers the pancreas, which sits behind the stomach, to release insulin and start secreting it out at higher glucose levels. Now, insulin actually has an effect on probably all cells in the body, which is something a little bit newer research, because I know when I was in medical school, we really just talked about muscle cells, fat cells, and liver cells as far as insulin's effect. We didn't think it really worked on the brain, but it looks like there may actually be some effect on insulin, not only on brain cells, but on nerve cells as well too. And I'll have another video that kind of talks about that, specifically going into why do people develop like a diabetic neuropathy. Is insulin a factor in people developing Parkinson's or other neurodegenerative diseases such as Alzheimer's as well too. But again, as our glucose levels go up, insulin gets secreted by the pancreas. And that insulin will float around into the bloodstream, bind to certain receptors on the cell wall of muscle cells and fat cells, and pretty much what they do is they trigger a glucose transport mechanism called GLUT4 or GLUT4 that usually sits inside the cell until it gets a signal from insulin saying, hey, there's a lot of glucose floating around the bloodstream. We need you to come up to the surface and help pull that glucose into the cell. So in muscle cells, what happens? Those GLUT4 receptors come on up, or transport mechanisms come on up, pull glucose into the cell. The muscle cells will then store glucose as glycogen for further storage to be used later on. But it'll also tell the muscle cells to stop making glucose as well too. So we call gluconeogenesis kind of gets put on hold as well too. So high levels of glucose means we have high levels of insulin, which means we're going to store energy for later use. We see the same thing in fat cells. So circulating insulin binds to an insulin receptor on the fat cell. That tells the fat cell to take in the glucose, store that glucose as glycerol, which then can be combined with free fatty acids to be stored as triglycerides, which is how the body stores most of its fat as well too. So again, insulin really more of as a storage mechanism, a storage signal to the body. Now the other mechanism that insulin has is on the liver as well too. And kind of the same thing as it does with the muscle cell. It tells the liver cell, hey, there's a lot of circulating glucose, take it in, store it as glycogen. But it can also tell the if there's too much glucose, and now if the circulating glucose levels are too high and the liver starts making too much glycogen and kind of maxes out as much glycogen as it can make. The next step that the liver cells will start doing is, again, turn that glucose into glycogen, combining that with the free fatty acids and storing that combination is triglycerides. And that's where a lot of this fatty liver disease or the non-alcoholic fatty liver disease comes from too. Again, it's a surplus of energy. There's too much glucose, too much insulin, driving everything into the cells. And the cells are just trying to store it until it can take care of it later. And so I think that's really important to kind of understand. Now, as glucose is getting driven into these cells, the blood glucose levels obviously are going to drop a little bit. And as those blood glucose levels start to drop, we'll see less and less insulin being secreted by the pancreas. And we'll also see another hormone called glucagon being secreted by the pancreas as well too, out of the alpha cells. And glucagon kind of balances out insulin. It's this really kind of tight dance that the two hormones do. So glucagon tells the cells, hey, wait a minute, we haven't had anything to eat, glucose levels are starting to drop. We need to actually reverse and start taking energy out of the cell. So glycogen gets broken down into glucose. Fat cells or triglycerides get broken down into free fatty acids and glycerol gets broken down into glucose as well too. So it's this really tight dance that happens. So it's almost like the tide coming in, the tide coming out. When we eat, we have a surplus of glucose that ends up getting stored when we're fasting. So overnight when we're not eating, or if we've gone several hours in between meals and there's circulating glucose start to up, then we get the signal from glycogen and the lower levels of insulin to actually start going the opposite way, to start making glucose in the cells, to actually start breaking down glycogen and pushing that out as glucose as well too. So it's really important to understand that. And that really then goes into the next video as far as talking about, so what happens when we have an abnormal response? We know what the normal response is now to insulin as far as how it helps store energy. But what happens if we have insulin resistance? What happens if our circulating insulin levels are too high for too long? How does the body respond to that? What's happening with that? And what's the next step after that? And what are the issues that we're seeing? We're talking about heart disease, we're talking about hypertension, we're talking about diabetes because glucose levels are staying too high. Those are all the issues. And I think that's one of the problems that we look at. We look at diabetes and some of these other diseases as being a glucose disease. And really, I think what we need to be thinking about is looking at more as an insulin disease, because I think the high levels of insulin we know are elevated for years before we start seeing elevated glucose levels as well too. So anyhow, so that's just kind of a quick little summary of how insulin works in the body in a normal fashion. We're going to talk about in the next video what happens when that mechanism doesn't work properly, what happens with the insulin resistance. So look down below for the links. There's also a channel that has all the insulin videos too, so it's going to have all of them going from the what is insulin, how does it work, insulin resistance, how to reverse it, insulin with hypertension, heart disease, diabetes, things like that as well too. More importantly, if there's a certain topic you want to see me cover, make sure you leave it in the comments down below. Hit the like, hit the subscribe button. That's how we get more people watching this content. And again, I'm Dr. John with the Healthy MD. Be healthy.